All week, we've been warning you of the growing measles outbreak in Texas. Here's what we know right now. According to the latest update from the state health department, there are currently 124 cases in the state of Texas. Now, this outbreak is confined for now to 9 counties in West Texas. You see them here. So far, no cases have been reported here in Harris County. And while today officials confirmed a measles case in Rockwall County, that's near Dallas, we're told the unvaccinated patient did travel internationally and is not considered part of this outbreak. Also today, the first measles death has been reported in West Texas. Health officials confirmed the patient was a school-aged child and was unvaccinated. Of course, we are staying on top of this outbreak for you tonight, and we do have team coverage tracking the cases and looking into how you can keep yourself and others protected. But we start with Victor Jacobo with how leaders here in Harris County are preparing for the spread. Victor.
Mayor John Whitmire told me that he is confident in the city's ability to swiftly address the measles outbreak that's growing in West Texas. I asked the mayor about what the city is doing to monitor the situation. Whitmire says he has personally gotten briefings from his administration and health experts. That includes members of his administration with the Houston Health Department and officials from the Texas Medical Center. The mayor told me he is relying on medical experts to get the most up-to-date information as the outbreak grows.
And you're confident in the city's preparation?
I am, but you know, I don't have firsthand medical knowledge. So that's the reason I depend on our departments. So when you get a measles breakout, you have to have full alert with the medical director, go to your emergency centers, get the best real-time information.
Today I spoke with an infectious disease expert from the Baylor College of Medicine. He told me that the outbreak in West Texas is likely to grow and that the Houston Livestock Show and Rodeo starting this weekend is a high-risk event for further spread. For now, reporting outside Houston City Hall, Victor Jacobo, KHOU 11 News.
Victor, thank you. Tonight, parents have questions on how they can protect their families for when the measles do spread closer to home. Katira Winfrey joins us live with that part of the story. Katira.
Hey, when big interest stories like this happen, social media is often buzzing with people suggesting holding measles parties to expose their children to the virus in the hopes of creating some natural immunity. But experts here at Texas Children say you may remember in the 80s chickenpox parties, but they say the measles is a far more serious infection. A first death linked to the West Texas measles outbreak is creating growing concerns for parents and doctors across Texas.
You know, the measles infection historically has been known to be one of the most infectious viruses out there.
Sapna Singh is Chief Medical Officer at Texas Children's Pediatrics. She says with reports of exposure in Central Texas and that death, we should all be concerned about this growing outbreak.
I think that is the most unfortunate outcome. My heart goes out to the family.
When it comes to protecting kids, vaccinations are the best tool. Vaccines are given out in 2 doses. The first typically around 12 to 16 months old, and the next between 4 to 6 years old. And even without the 2 full doses, Singh says the protection rate is still high.
1 dose of the measles vaccine protects at almost 93% effectiveness, and with 2 doses, that increases to 97%.
What you should not do, she says, is expose anyone to the virus intentionally. For example, in a so-called measles party, like the chickenpox parties of the 1980s.
Measles is far, far more complicated. It's a more serious infection than chickenpox. For every 1,000 children who's infected in the United States, 1 to 2 may die from the measles infection if they are unvaccinated.
Singh says the possibility of complications from an infection aren't a risk parents should take. And experts say if you have more questions or believe you need another vaccination, to contact your personal physician. Reporting live in the medical center, Katira Winfrey, KHOU 11 News.